Welcome to the webinar on Oncology Care Model, hosted by Persistent Systems and Salesforce. My name is Vishal, and I'm a marketing manager at Persistent, serving as a moderator on this call today. I'm absolutely delighted to welcome Melissa Boyle, the Senior Director for the Healthcare Industries at Salesforce. Without any further delay, over to you, Melissa.
Great, thank you so much. We have a full agenda today, so very thrilled to be a part of this. As she mentioned, I am a Senior Director on our Healthcare and Life Sciences team. I'm primarily focused on how providers are innovating with our technology, whether they're using it for growing their sales business, driving operational efficiencies, or getting closer to the patient. There's wonderful innovation in the provider space, and I'm thrilled to be sharing that today. Before I start, though, I want to just talk about Salesforce in general for those who don't know. Many of you may know that we have a 1-1-1 philanthropic model. I'll explain this a little bit. What it means is we give 1% of our employee time, 1% of our equity, and 1% of our product away to deserving nonprofit organizations. In healthcare, we have a special take on this, and so those pictures on the right you see, these are from amazing companies we work with, one of them being Caregiver based in Southern California. Every year, Care Harbor rents a massive stadium in the LA area, and they invite over 4,000 needy people to receive care. They do anything from vision correction, mammograms, dental work, you name it. The amazing thing is that the entire process is built on Salesforce from end to end, from the moment they register through their journey getting treatment, and even post-treatment follow-up. It's all done through Salesforce. Our philanthropic work is absolutely amazing, but it's even better when we partner with companies who are providing wonderful care to those in need. Now, our name, Salesforce, it's definitely a little bit misleading, isn't it? But our success is absolutely proven, and it's proven across all 4 segments in the healthcare space. Whether you're a life science company with a very traditional sales team, whether you're a payer trying to acquire new members, or even our provider accounts, everyone you see on the screen, every one of these customers, and probably everyone on the phone, is trying to get closer to the customer like never before. And the reason is that there's a massive shift in healthcare today, and it's all focused around the patient. There's 3 major pressures that are causing this: regulation, expectations, and technology. So let me break these down a little bit more. First, it's no longer about driving volume, it's about driving value. New reimbursement models have changed the way you get paid, making it you're either incentivized, penalized, or paid as a part of this whole new model. And at the center of it is the patient, their happiness, and their outcomes. But patient expectations are greater than ever before. Every single day in our lives, we use our smartphones, and it makes life more convenient. Think about it, anything from banking to transportation. You can call and use you can use your Uber app and have a car waiting for you in a minute. Every day of our life, we have these conveniences with our mobile devices, except in healthcare. Then it comes to a screeching halt. And that's because technology is empowering us. Most of us have wearables on, or we collect critical information that we want to share, data that can make a real impact in our outcomes. But today, it's not easy to share that in healthcare. So our vision at Salesforce is a future of healthcare being focused on precision. Now, precision healthcare, it takes its concepts from precision medicine. Obviously, everyone on the phone is very familiar with precision medicine, but it's that new initiative to revolutionize the way that cancer is treated. It takes, on the left side of the screen, the genomics and the demographic and the lifestyle data to allow you to predict which treatments are going to be the most effective. But at Salesforce, precision healthcare doesn't use genomics, demographic data. We use relationship data and clinical data and real-time biometrics. We put it all in a single place so that you can predict what type of engagement is going to be the most effective. Ultimately, this gives you a deeper one-to-one understanding of your patient. It brings everyone together in the entire organization so you can make smarter care decisions. And then, of course, you can do this from everywhere on any mobile device. This is what we call precision healthcare. Now, with every Salesforce slide and narrative, there's always a problem. And the problem is that for decades, healthcare IT has invested massively in systems that help them get paid. So in the 70s, it was revenue cycle management, which turned paper bills into money. The next era we saw was electronic health records, and this was really accelerated by the stimulus budget, and it helped all hospitals get rid of their paper records. Now, these systems are vital. They play a critical role in healthcare. They always have, and they always will. But the problem is that they're simply not built for the future. They don't easily connect to other devices. They aren't built for collaboration, and the data isn't accessible everywhere. It's easy to get in. It's not necessarily to get information out of these systems. They simply weren't built for the future because they didn't need to be. There was no financial incentive to build these systems to be mobile or social or open, but all that is changing. So we have a little trick at Salesforce. If you want to know where healthcare IT is going to invest, follow the R's. So in the beginning, it was all about revenue. Then we saw it be about records. And today, where's healthcare IT investing? Relationships. They're investing in relationships. So why do you invest in relationships? Because relationships help you understand your patients, helps you understand their risk and the ability for these patients to adhere to their care plans and truly understand those tasks assigned to them. You invest in relationships with your employees and your care teams because it fosters collaboration. It breaks down communication silos. But ultimately, you invest in relationships because it drives better outcomes and it improves the overall patient experience. This is why at Salesforce we are helping and we're committed to helping providers invest in relationships like never before. And it's through our partnerships with persistent systems that we're delivering on this. We're helping provider accounts build relationships and not records, giving you guys a complete view of your patients, allowing you to make smarter care decisions, and of course engage seamlessly across the entire healthcare system. Now there's a number of ways persistent system is doing that, and I'm not going to steal their thunder, but I will say if you want to learn more about Salesforce and our healthcare solutions in general, please go to salesforce.com/healthcloud. There's a number of ROI papers, other webinars, industry-leading thought papers, wonderful materials to get you familiar with all the ways that you can innovate with Salesforce. And of course, with that, I want to say thank you and turn it over to Jim Rogers. Jim?
Hi, thank you, Melissa, and hello to everybody on the phone. I am Jim Rogers, and I am a registered nurse. I am not trained in IT, and I've been working in healthcare operations for 15 years and customizing Salesforce for healthcare programs and services for the last 10 years. I started my nursing career in critical care, doing neuro ICU, cardiac cath lab, cardiac rehab, but I transitioned to the specialty that I earned my registry in while I was attending nursing school. I'm a registered nurse and a registered polysomnographic technologist. That's a crazy term, so it's actually just a sleep technician. And I was always fascinated with sleep medicine because there was an opportunity to change somebody's life with a couple of tests and intervention. And operationally, when I came back to sleep medicine program as a director, there were really no software tools that you could use to map a patient's journey to better health. The process was pretty complex. For sleep medicine, there's an order from a physician with very specific symptoms to qualify for that test. There's a verification process with using just the right words to get an authorization for that test. Scripted conversations with the patient to convince them to spend the night in a sleep lab and put a bunch of electrodes on their head and their body. There's a post-study scoring that's done by a technician. There's detailed reports that are done by an interpreting physician, and then there's an interpretation that's made. A second study can be ordered if that's indicated. It goes through a whole other process for scheduling the patient. And then there's a scripted conversation again with that patient to convince them why they need to come back for a second time. There's a repeat scoring process. If the patient has sleep apnea, which most do, there's a DME setup and an appointment for a CPAP, continuous positive airway pressure device. There's fitting of those masks and documenting the equipment that was delivered and what sizes were tried and what the outcome was for that equipment. There's a scripted compliance follow-up process. And then there's an outreach after that for maintenance and supplies. This is a lifetime relationship and a journey for this patient. And we were attempting to use an EMR as a scheduling software, but there was no place to document this process. We use spreadsheets to track the flow and handoffs, and I'm sure that probably sounds familiar to many of you on the phone, trying to find the right tool to track documentation and workflow. What was needed was a program that we could completely customize, somewhere where we could identify patients and load their demographics, but what we really needed was a place to track this patient's journey to better health. What were we seeing them for? Where were they in this process? What was our outreach to them? What was the result of that outreach? What were the milestones along the way? What milestones dictated a different workflow or a different outreach method? There was no program that offered all of this for us, and so we decided to build it on a cloud-based program that could be completely customized to match our entire program, processes and workflow, and that was Salesforce. And again, I'm not an IT guy, no training, no direction. I created a sleep medicine tracking program in 1 week in Salesforce. That just shows you how easy it is to customize the Salesforce platform. And that was 10 years ago. It was pretty simple, but it updated daily, weekly, and monthly until we could report on every patient and where they were in the process, what their milestones were, what interventions were successful, and we documented all of that through dashboards and reports and shared that with our senior leadership. This success led to adding multiple other ancillary services on the Salesforce application, and those included cardiodiagnostics, neurodiagnostics, complex imaging. We could report to senior leadership which schedulers had the best close rate to getting patients to complete their appointments. We tracked efficiency. We tracked cost per study, quality measures, patient satisfaction, revenue sharing with our other providers. When we joined the new organization, none of these other service lines were involved, and they couldn't track a patient journey like we could in sleep medicine. And so we moved all of those onto this same application, the same one we started with 4 years earlier just for sleep medicine. And in 2009, the medical group that I was a part of asked us to build a nurse navigator program for oncology. This was at a point where there really was no navigation tools for any program like this, much less oncology. There was barely even a certification for oncology navigation. And our medical group employed oncologists, radiation oncologists, surgeons, primary care physicians. We had complex imaging centers, surgery centers, radiation oncology centers, and infusion centers. From the operations side, the mission was simple: keep the patient from engaging in services outside of our group in order to maximize revenue, track quality, and influence clinical outcomes. From the patient side, obviously very different. The mission was to employ nurses and lay navigators to virtually hold the patient's hand from suspicious lesion to remission or hospice. The tagline was, "Why navigate cancer alone?" So I became a certified breast cancer navigator, and we built an oncology patient navigation tool to engage patients and track their milestones and drive workflows. And we built that in Salesforce. And we built that on top of the application that we started 5 years earlier. And this took about 3 weeks to build. The program's wildly successful, garnering praise from patients and family members and PCPs. So fast forward to 2014, and my wife and I moved from Texas to Colorado, and we joined Centura Health. And really, this was the next chapter of building a care coordination platform for accountable care organization patients. We also needed to build a contact center that offered telephone nurse triage. We needed a software tool to engage patients and track their journey to better health. We needed a way to document care plans, outreach plans, nurse triage interventions, patient engagement. And so we built a custom application, Salesforce. Certainly this was much more complex than the previous solutions that I had worked on. And it married a 24/7 contact center with integrations for call management, nurse triage protocols, patient education. This program took 30 days to build. And today, I have successfully transitioned out of operations into healthcare solution delivery. I've been with Persistent for 2 weeks now, and I'm very excited to help other organizations really leverage what's been built for population health and create programs for oncology. And that's actually being done in the organization Centura that I just left. The program that was created for care coordination is now being adopted for oncology navigation across 16 hospitals, engaging numerous previously siloed nurses. Much of the structure was already there for population health. We only had to add specific fields and record types for specific cancer protocols. And all of these nurses will be live in 2016 on that program. And I apologize for the long introduction, but I really wanted to tell you why I'm excited about this new oncology care model and why Salesforce Health Cloud, with custom accelerators and programming to fit your oncology application built by Persistent, is really the right solution for this. So let's talk for a moment about what Persistent does. Persistent's been creating both on-premise and cloud-based custom applications for multiple industries in the U.S. and around the world for 25 years now. And before Salesforce even announced Health Cloud, Persistent had developed and implemented healthcare-specific applications for referral management, care coordination, decision support, contact centers, and patient engagement. Much like some of us in the independent healthcare world, we're developing these same things. And now we're able to bring all those things together on Health Cloud. But these accelerators were built on Service Cloud, and they serve as pre-built customization layer that can then be customized again to fit a specific healthcare program or use case. And this process can significantly reduce the time and the cost of starting from scratch, either at the Service Cloud level or even as Salesforce prepares to launch Health Cloud. These accelerators will take Health Cloud to the next level, really pushing the envelope on how the Health Cloud application will be used, and yet still completely customizable for your specific organization or use cases. So Persistent is really leading this digital transformation in healthcare. They're a trusted partner of Salesforce for Health Cloud. They work alongside the top healthcare systems and payers in the United States and around the world. They have experience in multiple healthcare spaces, including oncology, substance abuse, and wellness programs. They're nimble and fast and effective in the development of these applications on the Salesforce platform. So let's talk about the key components of this oncology care model that CMMI has introduced. The program is developed and is specific to patients with a cancer diagnosis undergoing chemotherapy treatment. There's three key components to the program. There's a huge focus on care coordination and patient engagement that involves using patient navigators, comprehensive care plans, patient outreach, and the ability to measure and report outcomes. There's also a component that involves 24/7 access to the clinical team for the patient. And the goal for this is that it should lead to improved quality of care and reducing complications for patients who are being treated for cancer. And it should result in fewer acute admissions, less ED visits, and that should reduce the total cost of care. And then I'm sure most of you know there's 4 ways that a provider can be compensated in this model. There's the traditional fee-for-service for chemotherapy. There's shared savings for reducing the total cost of care. There's a performance bonus for meeting specific quality measures, and there's a per beneficiary per month for providing care coordination activities. So let's talk about the development and implementation of a patient-centered care coordination program and the activities that are related to that. As you can see on this slide, there's a number of activities, but they're really all centered around the patient and the navigators or coordinators or caregivers that are guiding this patient on a patient journey. And so key questions to ask is, as you're building a care coordination program, who does the patient call? How are calls escalated? Who gets notified? This is the 24/7 access for patient care. And this can be done through navigators during the day. It can be done through on-call programs and processes. But one of the ways that we solved this at Centura Health was creating a 24/7 nurse triage program so that after hours, patients could be referred to and directed automatically to a nurse who had access to the same care plan, who knew where the patient was in the process, who knew what their educational deficits were, what their barriers to care were, and could really guide that patient in seeking the most appropriate care. And then another question is, how do you document social services needs? What are the patient's barriers to care? Do you have a screening tool that identifies these needs and a workflow for intervention? Do you have a dynamic questionnaire or survey process that based on the answer that you get from the patient that you can change your intervention for that patient? Do you have a database of social services? Do you track those referrals and do you follow up to make sure that the patient had their needs met? How do you coordinate appointments with other providers on the team but not in your scheduling system? Do you have a workflow for follow-up? One of the challenges that Centura Health faced in doing their care coordination from an integrated physician network level is that the integrated physician network, 3,500 providers, is on 21 EMRs. How do you integrate with 21 EMRs? You can't do that, but you can create a program that gives access to all of these providers who are a part of this care team. Who's in your provider network? If you're doing referrals, how do you know where to send a patient? How do you know who does what services? How do you know where they perform those services? How do you maintain network integrity? That's a big buzzword these days in healthcare, is how do you maintain your patients within the network that you've developed? What about secondary referrals from one provider to another provider and then to a service or facility? Most referral management programs don't track that secondary referral, but that's where you can really increase your costs through leakage to an outside organization, and you can't control the quality of the services that are being provided to that patient. What do you do with out-of-network referrals? Do you track the reason for an out-of-network referral? What out-of-network referrals are actionable? Do you have gaps in care in your network? Do you have service or geographic gaps? Do you need to involve your provider relations team to fill those gaps in and really create a full service network for your patients? Where do you collaborate on decision-making for your patients? Where's that documented? And are you using best practice? Do you know what best practice is? Do you have a place to reference best practice for all of your care team? And do you have a decision-making tool for the patients? Do you follow a scripted outreach plan based on the patient's current episode of care? Is it a dynamic plan so that when you reach a milestone and that's either completed or you miss a milestone, do you have appropriate workflows or interventions that you can initiate? Do you have a comprehensive patient engagement and education plan? Does it include caregivers and family members? Can it be delivered in multiple formats to best fit the patient? Is it telephonic? Can you email or text? Can it be web-based? Can it be in a patient portal? Is it dynamic based on the patient's current progress, complications, or learning style? Do you have a consistent, repeatable process for reaching out to patients with specific conditions and specific education goals and methods? All of these components are necessary to satisfy the requirements for the per beneficiary per month and quality measures for the oncology care model. Persistence Patient Success Platform delivers a solution for providing these services. One application for coordinators, nurses, patients, physicians. One solution integrated for referral management, contact center operations, care coordination, patient engagement, built on the Salesforce Service Cloud platform, but ready for Salesforce Health Cloud. Scalable, customizable for your organization, for your oncology program, for your unique practice model. It's integratable with EMRs, scheduling systems, billing systems, risk stratification tools, lab programs. It's a total care coordination and patient engagement solution that grows, evolves, expands, and meets your current and future needs for your program. Let's talk about some of the specific pieces that are involved in this. So real-time caregiver collaboration through Chatter within Salesforce. It's included in the Salesforce platform, and it can be customized to include anyone on the care team inside or outside of your organization. It provides a real-time way to collaborate, to make decisions, to adjust and modify care plans, and to communicate interventions and the status of where that patient is in the process. Patient education and engagement tools. These can be integrated. They could be anything from video communication to chat to email to using a patient portal to integrating telemedicine and bringing in remote device data to doing face-to-face video conference calls, the ability to assign tasks, to track progress, and to engage the patient in that care plan and that progress so they feel a part of this. They're not being treated. They're a part of the treatment team and the treatment plan, including caregivers as well. Being able to see a 360-degree view of the patient, not just the static data that's in the EMR, but really being able to integrate labs and imaging, integrate pharmacy, treatment plans, care plans, outreach, engagement plans, goals, actions, and interventions. All of those can be created in a customized view of exactly what you or your patients or providers want to see in a given view. Then when it comes to measuring outcomes, data is incredibly important. But what's more important is what can you do with that data that really makes a difference? How do you make that data actionable? Can you drill down on it? Can you slice it and dice it and turn it into something that changes outcomes, that improves quality? Is it actionable data? Can you identify trends? Can you refine your processes and your workflows to achieve better outcomes? And that's really what Salesforce Wave can do, and it's available, and it can be integrated within this platform. So the question is, how will you manage your patients in this new oncology care model? How are you going to focus on patient engagement and care coordination? Do you have patient navigators? Do they have a workflow and a role and a process for outreaching to patients? Do you have comprehensive care plans? How are you outreaching to these patients? Are you measuring and reporting your outcomes? Do your patients have 24/7 access? How are you going to provide that? What tool are you going to use to improve the quality of care for your patients? How will you track and reduce admissions, acute admissions, ED visits, complications? How will you take care of these patients in the oncology care model? One thing that we've seen is there's really no place to document these things. And if you're using your EMR or you're using spreadsheets to do this, it's not a very good documentation for care coordination. There's no way to create workflows. There's no way to include multidisciplinary collaboration. You can't really report on quality measures. There's no workflow to assign patients to coordinators to drive engagement protocols. There's no timely way to engage patients that lead to interventions that reduce ED visits or acute admissions. For example, one of the things that the care coordination teams at Centuria use is a Call Me First program, so that regardless of whether the patient has symptoms or has a barrier to care or anything that's going on with that patient that's related to their treatment of their cancer, they have one place to call. And that one place or that one person has one place to look up everything they need. Everything can be documented in one system, and it can be shared 24/7 with providers, with nurses, with coordinators, and even with patients and caregivers as well. So let's talk about and discuss this further. We've got phone lines open and questions can be submitted. If you've already submitted some questions, Vishal is going to read those, and feel free to submit some other questions as well.
Hi, Jim. We have a few questions already for you from our audience today. Our first question for you, Jim, is from a caller who would like to know about the extent to which organizations have been able to enable integrations with clinical systems, specifically the electronic health record.
Sure, that's a great question, and it's incredibly important. And I put up the contact slide. Melissa Boyle could certainly share with you the hundreds of organizations that they worked with on integrating with Salesforce. At Texas Health Resources, we integrated with a practice management system that was integrated to our EMR. So it wasn't directly to the EMR, but it did allow us to import patient demographics and scheduling information. At Centura, we weren't able to integrate with the EMR, which was Meditech, but we did create daily and weekly extracts for patient demographics and appointment information. And since Centura was operating a care coordination program in an integrated physician network with 21 EMRs, there really wasn't a way to integrate with 21 different EMRs. The only reason we couldn't integrate with Meditech was actually just on the healthcare side. They were getting ready to replace it with Epic, and certainly Epic can been and has been fully integrated with Salesforce. It's been done with several groups, including persistent customers like Johns Hopkins. One of the things that we did at Centura is that we really relied on eligibility files from payers, and we shared that information back with our providers via either EMR notes, which we created customized ways to copy and paste information that aggregated that data, or through a community portal for participating providers.
Great. We have a follow-up question again, Jim, for you from the same caller around the PACS integration with reference to the diagnostic images and the screenshots that were shown during this presentation. The caller would like to know if there are any limitations to the formal integration.
So from the Salesforce side, there is no limit to formal integration with another system. Integrations can be done through APIs, they can be done through web service, it can be done through HL7, it can be done through FHIR. Typically the challenge comes from the application opening up their fields for the Salesforce to access those and bring that data in or write to that data. A lot of times this can be solved through a data warehouse model where the data that's in that system is synced to SQL tables or some sort of a data warehouse model, and then Salesforce can directly query those tables and pull information in, and if it's acceptable to the organization, it can be a two-way integration and push data back to those tables that then update the EMR or any other PACS system or any other healthcare system that might be utilized.
Okay, great. We have another question for you, Jim, from a caller who'd like you to comment on the key risks encountered when there is no system in place, and post-deployment, any of the key things that one needs to be mindful about that needs to be done right.
Sure. The primary risk of not having a shared care coordination platform is missing the opportunity to collaborate real time in the patient's plan of care. You can't really map out and document this journey. You can't track milestones, and you can't track where the patient is in that journey and what interventions are needed. You miss the opportunity to be proactive in your outreach to patients and your ability to standardize workflows across multiple care sites. For Centura, we have care coordinators who are working from home, coordinating care and collaborating with nurses who are working in a contact center, and coordinating with primary care physicians who are in their office and accessing the information through a portal. And it's very challenging to create that when it's also custom as well. And then the ability to create real-time notifications and escalations based on the data that's collected. That's really invaluable. The key thing to getting it done right and is getting buy-in from your front lines, getting buy-in from your nurses and your care coordinators, the ones that are using the system every day, and getting them to provide feedback pre and post deployment. That's really critical because you're building a care coordination program, whether it's for oncology or accountable care organizations. It's really an evolutionary process. Once you standardize an approach and get everybody on the same page, especially with a new program like the Oncology Care Model, there will be new insights, new processes that need to be developed and implemented. And having a flexible program like Salesforce versus a static program such as an EMR makes that process of growing and changing and reacting to changes in the marketplace for both reimbursement and best practice much easier and much faster.
We have one last question again for you, Jim, from our caller who'd like you to comment on both configurability and your experience with rules. For example, in a contact center with a Follow Me program, how did the rules work and how did it connect back to the reimbursement?
Sure. This is incredibly important, and it speaks to the reason why you would choose a platform like Salesforce. What Persistent can do is take a base application like care coordination built on Salesforce and tie it together with a contact center. And that contact center can use a CTI integration to a phone system. And so you can really manage what's happening with those patients. You can identify that patient when they're calling in before the nurse even picks up the phone and answers the call. They can know that, who is this patient? Do we know who they are? Do we know what primary care physician they're associated with? Do we know what specialists they're associated with? Are they in care coordination? And then as the nurse goes through the call, triggers can be created that evaluate that nurse triage encounter. Again, are they in care coordination? Is the chief complaint related to their care coordination plan? Who's the care coordinator? Who's the primary care physician? And then you can create a task for the care coordinator to follow up with the patient, and that would include a link to the nurse triage encounter. You can also trigger a notification to the primary care physician or the specialist in whatever manner they wanted. It could be through a community portal, secure email, or a text. And all of these things are vital to reimbursement and shared savings because there are opportunities to ensure that the level of care required to manage patients for this current episode is appropriate, and potentially, depending on your risk model, you could repatriate a patient from, say, a competitor's emergency department if you were integrated with a state health information exchange, and you could take them from that emergency department and admit them directly to your acute care facility. Things like that can reduce the total cost of care and ensure that any fee-for-service episodes are managed within your network.
I don't really see any other questions on my Q&A panel, Jim and Melissa, so it looks like those were all the questions for today. Now, before we go ahead and close the event, I'd like to take a minute to thank you all for taking time to attend this webinar today. We really appreciate it. We'd love to talk to you more about your areas of interest. Please feel free to reach out to any of the contacts listed on your screen. Additionally, you will receive a follow-up email with a link to the recording and the details of contacts at Salesforce and Persistent. Again, thank you so much and wish you all a fantastic day ahead.